As some of you will be aware, in every local authority area there is something called the Learning Disability Partnership Board. It's a partnership board because it's a partnership between the local authority, the PCT, and people who have a learning disability and their carers in that locality. Their prime responsibility really is to hold to account all services, I suppose, and to stimulate innovative practice to improve the lives of people with learning disabilities. So they're not just responsible for healthcare, they're responsible for thinking about housing issues, employment opportunities, reducing hate crime, all sorts of wide issues. But because they have that representation from the local authority and the PCT, they also have accountability about the quality of health services in their area, because they really are the main driving force to influence change. To this end, for the last 3 years, we have performed something called the Self-Assessment Framework, or the SAF, whereby each Learning Disability Partnership Board rates themselves on some very specific targets around health, essentially. And we then look at the evidence that they submit to back up their self-assessment, and we have a validation meeting to challenge them on some of their evidence, to suggest supportive mechanisms for helping them achieve what they wish to, and perhaps to help them focus on their areas that they need to do extra work on in the coming 12 months. This, as I say, has been going for 3 years, and I think whilst it's quite a lot of work for those that prepare it, it's the one way we can have of assuring ourselves that everybody is working on the same sorts of areas that have been agreed now nationally are important areas to ensure the improvement of health and healthcare for people with learning disability.